TAL has a real focus on mental health, and in a recently released white paper, you emphasise a whole of environment approach. So could you walk us through a bit of how TAL services have evolved to better support customers facing mental health challenges, first off?
Yeah, sure. I mean, I think for the industry at large, there is an increasing incidence of mental health conditions leading to claim. So we all know that, but as a leader in the life insurance industry ourselves, at TAL we want to lead in the way that we identify, prevent and support mental health conditions, not only for the individuals themselves, but also to ensure that the life insurance industry is sustainable and can continue to support people with mental health conditions. At TAL we were one of the first life insurers to appoint a head of mental health. We've also established a mental health action group which lets us have regular dialogue with mental health professionals and people with lived experience in mental health conditions, which helps us across the claims, underwriting and product teams to make sure that our products and the way we serve policyholders and claimants is fit for purpose with respect to this emerging set of trends. The mental health white paper was an important piece for us at TAL. We wanted to let people know that because we're a life insurer, we see a lot of what goes on in mental health. We don't have all the answers, but we wanted to share what we know so that we could be a part of the industry-wide and in fact community-wide dialogue on how to best manage mental health for all Australians. One of the findings in there was that there is a difficulty for people to get access to services. I think the stat is that there's 13 psychiatrists for every 100,000 Australians and 88 psychologists for 100,000 Australians, and that's very low when we consider it compared to other appropriate health professionals serving people with relevant conditions. We've worked hard also to think of ways which we can help customers or claimants, whether they're on claim or after claim, find access to mental health services, and recently we've just launched a service with Teladoc called Mental Health Assist, which does just that for people with mental health conditions.
Continuing in terms of that challenge for mental health claimants and the perception of them needing, it is a perception of them needing a greater burden of proof when lodging claims. So it wouldn't necessarily be the most seamless process for a lot of people who are suffering mental health issues. How is TAL working to streamline this claims process, and how are you leveraging digital to ease the claims process for them?
Yeah, I think that's really important first up, isn't it? That people with mental health conditions turn up in life insurance processes different to other claimants or people being underwritten or trying to get the right type of cover. In knowing that is to know also that first and foremost we need to be human about these things, and so we've worked hard with our claims and underwriting staff to be able to recognise and identify people with mental health conditions and consider different ways of asking questions so that the experience doesn't, in actual fact, create further issues for the person who is actually experiencing a mental health condition. At the same time, it's important for claimants and all claimants, but even mental health claimants, to know that they have confidence about where they're up to in the process, to have speed where they can and decisions and efficiency in the processes. So human first, but we're working on tools to assist claimants have a faster experience. So we've got a tool called Claims Assist, mobile delivered claims tool for people to manage and monitor their own claim. We've also worked on information to help claimants share their experiences so that they have a feeling of what they might go through when they're on claim or recovering from a claim. So we have a hub of information for claimants. And thirdly, we also try and connect people on claim with services, relevant services, whether they're on claim or after claim, to maintain their health.
On to regulation, ASIC has released this Customercentric design and distribution obligation, which has taken effect for the buy now, pay later sector. How do you think these obligations will shape the life insurance sector, and has it already prompted the industry to rethink some of its product offerings?
I think the life insurance industry is not immune to the same considerations, and we should take it very seriously. At TAL, we start with all of our process and service design around customer-centric principles, and that allows us to try and put ourselves in the customer's shoes first. It's also supported where we can by referencing relevant consumer bodies. In fact, we have a consumer consultation board which is chaired by our CEO, so we get access to the views of people who think about consumer needs and requirements all the time. That said, there's always something to learn, and so we have to apply ourselves to these principles, apply ourselves to making sure we expose our processes and our services to all of the feedback that allows them to improve. And I think life insurance needs to go ahead and be part of the same journey that is going on more broadly.
We're going to see more and more new technologies kind of bursting through into insurance and really reshaping how insurance is offered, how claims are processed, how customers are tracked for their claims. So we're looking at more and more AI implementations, IoT and sensor tech, predictive analytics. So how do you feel this will impact TAL and the broader insurance industry over the next few years?
The rise of technology is not something new. That said, for life insurance, the chance to embrace that trend, particularly after COVID-19, where we learned that using technology was a way to take people who are remote and make them more connected, was an essential thing. So I think it's a trend that's here to stay. And in life insurance, not only can we see the use of digital technologies to connect people and to serve better wherever those people might be, we also see the role of artificial intelligence and machine learning in the all-important processes that we run in underwriting or claims to make sure that we can give people confidence about decisions that we're making, make sure that the decisions that we are making have good quality, and in turn get to people with confidence around decisions about their increase for cover or indeed their claim. But in terms of enabling that journey altogether, digital technology is one thing, specific use of artificial intelligence or machine learning another thing. At the heart of all of this is data, and life insurers, and we're one of them, need to get control of our data so that we can feed those processes really, really effectively. And I think APRA recently spoke about the sustainability of the life insurance industry, and one of the key items that they put their finger on is the need for life insurers to have higher quality data and data management practices.
So what sort of systems are you having in place or put in place to basically make sure that the data you're utilising is ethical for one, but also maximises the best interests of customers?
Well, we've actually gone about this from the ground up because we realise the importance of this journey with respect to data. The fact that the trends aren't going away means that we need to be top to bottom, left to right, really good at managing our data. So we've established a data governance council and a data and analytics team here at TAL, where we're literally working with what we've got, but also trying to take a first principles approach and working our way through the data that we have and making sure there are standards and definitions across the plethora, and I mean lots and lots of data that we do collect, so we can organise it and access it effectively. That's a hard job. The enabling technologies that come along with that are things that we're investing in, data management platform, but also the technology that allows the safe and secure transmission of that information or data from the life company to partners and their customers and back again. And I really put an emphasis on safe and secure. That's a critical part of the journey.
So just looking at the wider insurance sector, what do you see as the main kind of social tech drivers that are influencing how life insurance is being executed, and how do you see this playing out over the next 2 to 3 years?
The whole idea that people are now focused on their living risks. So when you think about what the pandemic has done, it's made people focus on their own health and the health of others. And so the importance of the role of a life insurer in assisting with health prevention and health support is a real shift that won't won't be changing anytime soon. So that's an important social driver for us as an industry to respond to. The second part, which I think is also in that space of, focusing on more living risks, is that Australia now has more people drawing down on the retirement system than putting into it. And so what's the number one thing for people who are in pre-retirement or retirement phase, particularly if there are hundreds and thousands of new people in these segments every year from now on in? Oh, well, it's how do I make sure that the income that I have in retirement lasts as long as I do and for the purposes I think I need it for. I think the average retiree now, if the retirement age now is 67, will live for another 20 years. That's a long time to make sure that you live a good life. And so the role of the insurer in that is something that is an open space and an opportunity, and certainly something that we're thinking about. I think the only other thing that we've spoken a little bit about in the questions today is the rise of digital enablement. That won't change, and wherever you have paper in your process and it's not adding value with any kind of human contact, then digital enablement is going to be absolutely critical.
How far do you feel TAL has come in terms of getting away from the paper and moving towards a full digitalised process?
Every day, every week, every month, every half year, every full year, we're trying to get better at it. The most important thing, though, is working out where is it going to add the most value to people, and make sure that the human part of the process, where it's key, remains in place. And I think the other thing to be really clear about is that the way in which people interact using digital services continues to evolve. So we need to keep tracking, where and how people prefer, and what technologies they most like to use when they're engaging with somebody like a life insurer.